and I do deep healing work with women in Connecticut. No fluff or quick fixes here, just real honest talk about actually healing. Have you ever left therapy thinking, geez, we were just getting somewhere, and then we had to stop? What if instead of 50-minute sessions spread out over months and months, you could go deeper in a shorter period of time and experience real relief? That's what EMDR intensives are designed to do. Here's the challenge with traditional 50-minute therapy sessions. There's about 10 minutes of checking in, 10 minutes of wrapping up. That leaves only 30 minutes for actual healing work. And that's often not enough time to work through the layers you need to reach actual relief. Relief that isn't just from understanding and having insight up here, but full relief that you can feel in your gut and your whole body. It's the difference from being able to say, I have worth and value as I am, versus I have worth and value as I am, which is a full embodied experience. The start and stop rhythm of traditional weekly therapy can sometimes just feel like you're sprinting towards a finish line you don't have enough time to cross. So EMDR intensives remove this pressure of time. They give you longer stretches of time to settle in and get to the root of what's keeping you stuck, working through those layers that come up so that you can feel some deep relief. It's not about rushing through as much work as we can in the block of time where we're working, but instead it's about having space and a container to let the work gently unfold as it needs to so that you can go deeper to experience true healing. So how do you know if you're ready for this type of approach? You can ask yourself these 5 questions. 1, are you in active crisis? If you're experiencing severe emotional dysregulation or safety concerns, stability comes first. Once you're grounded, then it may be time to revisit doing some intensive work. 2, have you done some prior therapy or personal growth work? Most people who choose intensives already understand their patterns. They've done a lot of foundational work in weekly therapy and have lots of insight. They're just stuck shifting that insight into that full embodied change. 3, ask yourself, am I stuck despite all my best efforts? If you're thinking, I know where this comes from, I've done so much work, but I just don't feel better, an intensive may give you the space for the breakthrough you need in your mind and in your body. 4, do you have support outside of therapy? Even 1 or 2 trusted supports, 2-legged or even 4-legged, can really make a difference. And are you ready to be curious? You don't need all the answers, just a willingness to explore and gently challenge old patterns. Healing doesn't have to take forever. EMDR intensives offer an alternate route where you can hop off what can sometimes feel a little like a never-ending traffic circle of insight and introspection into that full embodied relief. Sometimes healing just needs a little extra space.